I am thrilled to be here. My thanks to the folks at the American Journal of Managed Care, which I co-edit, for inviting me. I've been introduced a lot of people on a panel. I actually haven't had the opportunity to introduce people that I actually may have voted for, but nevertheless, it's nice to be here. I'm going to take the moderator's prerogative and make a few comments, and I'm going to ask everybody, like we did in the last panel, to give a few brief comments, and then we'll have a few questions and then open it up to you for questions. So, as was announced in my bio, I'm a member of the Congressional Budget Office's panel of health advisors. And so I realized in the last session I needed to look for the back door. And what I'm about to say, I may have to run and leave this to the other panelists to moderate. But I want to say something about the value of prevention. So most of my research in the past 5–10 years has focused on the concept of value-based insurance design. Value-based insurance design argues that the financial barriers for services that we believe are important, that in many ways define quality care, should be kept low. Because if you raise those barriers, there will be less use of the things that we measure the success of our healthcare system by. And I would be a much wealthier, happier person if all of that saved money. And so what I have to tell you is, unfortunately, although you could not find a stronger advocate for prevention, I believe if you look at the research critically and unbiasedly, you will find that while prevention is crucial in a whole number of ways, it simply can't be the way we hope to finance our healthcare system. I can give you many sites. You can get my contact information through the American Journal of Managed Care. I don't want 1,000 email exchanges. But there really is an important question about how we have to make actually the hard choices. The beauty of prevention is if it did save money, and I can't tell you again how much I wish it did, and in some cases it does, but as a broad strategy, I don't think it does. I think if it saved enough money to pay for the healthcare reforms we need, we would all be happier people and things would move more quickly. I think the problem we face is we are going to have to make tough choices. And what I want the panelists to talk about today, hopefully, is what the ramifications of those tough choices will be.